I also, now we have among ourselves somebody who we used to see with awe. When I used to go to Bombay, went for Bombay for short training, I used to see Dr. Piloo Hakim there from JJ Hospital, coming for different courses whenever we went to Bombay, and we used to see you with awe, ma'am, and you were a great aspiration. She's one of the, I think, first or second person to be ENT in India. A great round of applause for her, and I request you to give 2 minutes of your ma'am and give words of wisdom. Dr. Piloo Hakim, please.
My dear friends and colleagues, at the outset, I would like to thank Dr. Agarwal for the wonderful talk that he has given, and also personally welcome him. It's wonderful to see him after so long. I would also like to personally thank Dr. Sharmila, Dr. Kalpana, Dr. Chanchal, and Dr. Abha for this creation of the Association of Women Otolaryngologists of India. It's a long time since the women have come to the forefront in this field, and I can assure you of that, as I was one of the first ladies to take up ENT in India. One of the first. There were two ladies prior to me. One was a doctor, I think, Singh in Delhi, and Dr. Professor Leelavati from Madras Medical College, who happened to be my examiner at the MS ENT examination. For me, I always wanted to be in the medical profession. But I was keen, I loved children, and moment I entered medical, I knew I wanted to be a surgeon. So my aim was to be a pediatric surgeon. However, my father, the late Dr. R.A.F. Cooper of the R.A.F. Cooper Award in the AOI, whom Dr. Agarwal also knew very well, wanted me to take up his specialty, so I said I would try it. Within a month or two, I realized that almost 1/3 of the patients I treated were children. And it was a delicate specialty. It required a lot of skills, which I think women have. And also that the emergencies, though they were there, were not so frequent as in other surgical ones. So I thought this was great, and I took it up. And I have never regretted taking it. In the early years, I was the only woman at the whole AOI conference, and it was great. It was not only there, but even abroad when I went, and I went to workshops. So I never had to do anything. I was always taken out and looked upon, and it was a lovely feeling. But at the same time, as other women joined, there were two from Gujarat, Dr. Ruby Udwadia and Dr. Hansa Edenwala. And then Dr. Sandra Disa from Bombay, whose father was also head of department at KAM, Dr. Jo Disa. And she, in fact, is the pioneer in cochlear implant in India. In fact, everyone else came up after her. She was mocked when she started doing it. And she proved that it was in childhood. When she first did, I remember, I think Dr. Agarwal may also agree, and that people said, oh, you can't do it in children. But now we all realize that that is where it starts. So since then, there are lots of youngsters who have come up among you and in different fields. ENT is an ongoing progressive specialty. And I think there is a lot more in it. In the few years that we have seen, there has been fantastic advances from open surgery to endoscopic. And I think the future is that all of you must super specialize. That is where the future is. You must work, as Dr. Agarwal said, do projects together, give records. And the idea is to have a group practice. I always feel that is better. I don't know why we don't do it in our country. You have a group and each one takes one aspect of your specialty. You work together, you have support, and thereby you can have more time even for your family and for your work. and the stress is reduced. So right now, I have told them that I am not going to talk much. I would like to say a little more, which I will maybe sometime during the conference. But right now, I welcome you all and wish you to have fantastic progress in this field. Thank you very much.